Hey everybody, this is Dr. Jerrad Swanson here at Comfort Family Chiropractic. We're here today to show you one of our modalities that we do. It's called cupping. Probably a lot of people have heard of cupping, especially since Michael Phelps in the Olympics had those big, weird, bruise-looking things. They're actually more like the untechnical term, hickeys than bruises. And I'm kind of here to debunk some of the myths about cupping and kind of show you what it can do and how it can benefit everybody. So my lovely assistant Bethany here has had some neck issues, some tight muscles in the posterior portion of her neck, and I'm going to show you a couple cupping techniques that I do here to help benefit with that. So first of all, we always make sure that we do a thorough exam that cupping is the right modality for you. And with her, she has a lot of tightness going on in this right trap. So I'm going to find the area that has the biggest knot, and we're going to go ahead and put a cup right on it. So cupping does several things. It brings a lot of blood flow to the area. It helps the body drain the lymphatic system, which is just our body's kind of sewage system. It pulls all the bad nutrients, bad blood through, and then recirculates it through. So a lot of times when we have chronic tight muscles, we get a lot of buildup of all the old nutrients, the old blood flow that isn't really pulling out of it, and it can really bind up and tighten the muscle. So cupping helps pull and release that out by causing a negative pressure underneath the skin and pulling the skin and fascia and muscle portion into the cup. And then we're going to actually have her go through ranges of motion, which helps break up the microfiber adhesions that are in the tight muscles. And with that, it allows the lactic acid buildup and all the blood capillaries that are trapped in the muscle to actually free up and come into the interstitial space, which is just a space between the muscle and the skin, and that lymphatic system can come through and drain it out. So I'm going to have you turn your head all the way to the left, and we're going to tuck the chin down. And as you can see, we get quite a bit of blood flow to the area already, and we're getting some pulling through the neck just from that negative pressure. It's kind of almost like having a thumb right at that spot. We'll have you come back up and then back to center, and then we're going to do another one to the left and all the way down. Good. And I noticed right away that she has a tighter spot right above it, so we're going to actually put a secondary cup right above that spot. We'll come back to center. Good. And then all the way to the left and back down. Good. Her range of motion is restricted now because the cups, again, are like almost having a thumb there, so it tightens the muscle up, allowing it to limit its glide because it's actually pulling the knots through it and getting the really good stretch from the two insertion points on the muscle. And we'll come back to center. Good. We'll let you sit there just for a sec. So a lot of the time, the bruises that we're getting is more like a hickey, as I said earlier. It's actually just that blood flow getting pulled to the surface and getting trapped until the lymphatic system can come and sweep it away. So it doesn't really feel like a bruise. A lot of times when you push on it, after about 20-30 minutes after you get cupping, it doesn't really hurt, maybe a little tender, and by the next day it just looks like a bruise. And then you can push on it all you want and it's not going to hurt really at all. Some of the side effects that you can get with this is first hour or two, we'll get a bit of that numbness, tingling, almost burning sensation on the skin. And that's just the skin's reaction to it. And it's going back, its elasticity is returning back to the skin to make it that smooth contour because we're getting so much bubbling of the skin up into that spot. So if you or somebody you know has chronic tight muscles, frozen shoulders, knots, adhesions, or just muscles that won't relax or give in no matter how many massages you get, this is a really good substitute, and it can really be beneficial for rehabbing people and for some rehabilitation with tight muscles from working out even, and can get some really good restoration from that. Well, thanks for watching the video. If you have any questions or you think this might be right for you, give us a call here at Comfort Family Chiropractic. You guys have a great day.